if you'd like to introduce yourselves in the chat, please feel free to do that. If you have any links that you want to share for things that you've been doing, you can do that as well. We're bang on 12:30, so I'm going to go ahead and start. I'm sure we'll have a few more people trickling in. So welcome everyone, my name is Veronica, and welcome to this 17th Rural Health Equity Chat. So just a little bit of an introduction. So I'm a GP and the founder of Rural Health Compass, and these Rural Health Equity Chats are a bit of a cross-sectoral space to help us all have discussions around rural health equity topics. So today we have Dr. Rebecca Orr, who is a GP in Northern Ireland. She's also a researcher and the chair of the NI Agri-Rural Health Forum. So she's going to be telling us a little bit about all of those activities, I suspect. And I hope then that we'll have a lively discussion afterwards, and then we should close at about 1:30. So if I stop sharing my screen, and I will then let Rebecca put up her slides. So please, Rebecca, go ahead.
No problem. We'll check that we can see this. Can we see everybody?
Yeah, we can see.
Perfect. Thank you, Veronica, for that introduction. I am Rebecca. I am, yes, a PhD candidate at Queen's University Belfast. And I'm today invited to tell you a little bit about, in the next 15, maybe 17 minutes, about the farm cardio study, which is the umbrella term for the research that I have been doing, and then the Northern Ireland Agri-Rural Health Forum. But underneath both of those icons, really what my principles lie in is that we should have a no more silos approach to rural health inequalities. We can't really do work unless we work together. So this is just a friendly farmer. This is Glenn Cuddy. He's currently our deputy president in the Ulster Farmers Union. So you'll find out a little bit more about those pictures in a short time. My background is that I am proudly a rural medical student. However, there is very little rural in Queen's University Belfast. I chose there to study because it was close to home, allowing me to farm alongside studying medicine. Quickly found that I was underrepresented. Maybe the dozen medical students that were rural or farming in the 300 student year group quickly grouped together at the back of the lecture hall. But as we went through the years, we found that really the curriculum didn't represent many of our people, and certainly our people were very under-researched in terms of the papers that we were exploring together. My lived experience really did exemplify how we all know, and everybody on the call will know, that actually 80% of our health outcomes are determined by socioeconomic factors, not what happens in the clinical consult room. And with that experience of both primary care as a GP now, all the way through alongside my farming, I have fostered a real interest in One Health, and that's intertwined as a golden thread throughout all of this work. So I'm just going to fire on. This maybe won't follow the normal run of things in terms of Irma and our research presentation. So I'm just going to give you the salient facts as we want to distill down exactly the most interesting things I wanted to share with you today. So as I approached the research, I was interested in what are the determinants of health amongst farmers, and this question of whether farmers go to a medical professional or not about those concerns. But I didn't come with any preconceived ideas. I simply looked at the literature, as we should do as good researchers, and found that yes, like many other occupations, farmers do have a lack of cardioprotective exercise. We certainly consume a lot of caffeinated drinks and fast food in our endeavours to hold down a job off farm due to lack of profitability in primary production in the UK and Republic of Ireland. And as a result of all of those roles, we do have disruption to lifestyles, etc., that impact stress levels, hormones, and obviously your dietary intake. It is well documented that, like all rural dwellers, farmers are very self-sufficient, stoic. And sadly, there is a rising burden of mental ill health amongst the industry as well. We have the largest proportion of workers over 55 in any occupation in the UK. So we are ageing and we are male dominated in terms of head of holdings. You'll find that 8 out of 10 farmers are male. I decided to use patient and public involvement. I was very keen that we got them involved from the get-go to ensure that the research was relevant to them and was community-based. So William, Alan, Gary and Heather volunteered way back in 2022 2023 alongside the Ulster Farmers Union as our main representative body here in Northern Ireland to simply act as somebody who could facilitate meetings in a non-academic environment and provide some hospitality when needed to ensure that farmers were fed whilst they were dodging jobs on farm to do some research meetings. And after about 6 months of co-design, we came up with a question, and our design called the Farm Cardio Study in terms of a questionnaire and an interview, so mixed methods, and we sought to answer this question: what factors influence health behaviours in farmers at risk of cardiometabolic disease? They really thought that the health behaviour side of things was where it was breaking down in terms of the weakest link between determining that they had a risk factor, looking at their overall farm picture, and then actually ended up in the consult room with a clinician that could help them with that. So we used health behavioural theory to frame all of our research, and some of you may be familiar with COMBI. This is Professor Mikey's amazing framework. It's so easy to use. The farmers immediately got it because it's a behavioural change wheel, and farmers love wheels. So capability, opportunity and motivation are the 3 central tertiles that the ingredients of which affect a behaviour, and we'll go into a bit more detail. You don't need to go into it now. So in the red boxes there, you'll see 249 farmers responded to our questionnaire, and we had 153 expressions of interest for interview at the end of that questionnaire. It was a lengthy, beefy questionnaire, which really can't go into too much detail obviously today, but it was based on COMBI. So it asked lots of interesting mixed questions, and they were all built by the farmers. A statistician's nightmare, but obviously a farmer's dream, because they were able to reflect on that, and actually it was really engaging by the numbers that you'll see there on the screen. And we don't normally get that level of expression of interest in an interview. So briefly, the demographics from the questionnaire. Did we reach who we wanted to reach with this? And I mean to say the farmers who don't normally respond to research. So yes, 8 out of 10 were male. We did get some females, but typically we find with agricultural research, you'll find more females report in, because those are the people in the farm who respond to paperwork. So thankfully, we did get a good male representative sample, and a range of ages. So not just those, we've got a good range in the 51 to 60 year group, and the 41 to 50. A third worked more than 71 hours a week. That was my concern. Are we going to get the people with the risk factors? Are we going to get the busy people? And thankfully, I'm confident that we did. And a range of sectors, with dairy in the green there dominating, which you would expect in the UK and Republic of Ireland. Moving on quickly then, what did these farmers worry about? So whenever they picked up the questionnaire, the first question was, what risk factor are you worried about? And they ticked the ones that were relevant. So they could tick multiple, they could tick one. So high blood pressure came through strongly, weight gain and eating habits. And again, this is just descriptive information here. There's nothing inferred. We're just simply describing the sample. 46% of those farmers who had a concern attended their GP. So again, that is partly in line with what I would feel is the reality amongst clinicians whenever you're chatting to them. Yeah, about 1 in 2, but we'll move on to see what else we found out. 27% self-reported that their BMI was more than 30, and 35% reported hazardous drinking levels, and we used Audit C as a clinical questionnaire to guide that. So again, did we reach the people that we wanted to reach? I'm hoping that I can confidently say we did, because these, as you know, with questionnaire bias, people generally reflect better in their questions and self-reporting than normal, which has skewed other research in the past. And about 1 in 5, 18% were current smokers. So interesting findings. 72% said they were comfortable contacting their GP. 42% will contact their GP if told to. So again, that innate kind of responsibility within oneself, that motivation, the individual decision is very strong there. 74% had time to attend appointments, again, contrary to many suppositions that farmers don't have time to attend to their health. 50% in the consult, whenever those that did go to see somebody about the risk factor, just 50% were asked about their occupation. 53% felt they could trust their doctor. And again, that statistic for me goes round to my head at night time. It really does. I just feel very strongly that there's work to be done there. 26% felt the management plan that they received from the clinician, be it whether it was a pharmacist, a nurse, a GP, whoever it was, felt the management plan was achievable for a farmer. So a large majority there unable to enact the advice that they were given for whatever reason. What did we do with those that expressed an interest with interview then? So I interviewed 17 of them, despite me wishing to interview all of them, I'm sure, but it wouldn't be sustainable or useful to interview all 153. But out of those 17, 9 had attended their GP, so about half and half roughly, and 10 had 4 or more risk factors for cardiometabolic disease. So again, trying to target that population that wouldn't ordinarily pick up these studies. And again, briefly going through the tertiles one by one. Capability. So in capability, we look at the physical capability and psychological capability of going to see a clinician about a risk factor. And here are some quotes just to add a little bit of colour and hopefully spark some curiosity amongst you all as to what the data looks like. A potato farmer said, I don't seem to make it through the first sift. And what he's talking about there is the process of getting an appointment with their GP. So the triage process. He didn't feel that he was vulnerable enough to be able to get an appointment. And certainly he had tried over a long period of time. So another dairy farmer here in the middle said of thinking about getting his blood pressure done, it's like a fly in your hand and you brush it off, it's then gone. And what he said was, it's not that I don't think it's a good idea, but I think about it and then something rushes in, the cognitive overload of thoughts that affects my decision-making process just makes it peter away in the ether. And it's not that it's an unconscious deprioritization, isn't it, of that task. A pig farmer said that whenever, in terms of his behavioural regulation, he knew that self-care had become self-neglect. So acknowledged it, moved on because of other priorities at that time on the farm. This is what you have to do. We want you in. This was a female dairy farmer who simply said, in my view, I would have to have the decision taken away from me and the permission granted that I am valuable enough in terms of my risk factors, in terms of my demographics, my occupation, to come in to get these questions asked to me in the room. And then, I can do the rest once I know the data and evidence that I'm faced with. So interesting findings in terms of opportunity. I don't know why this is something's happening here, but anyway, opportunity, we talk about physical opportunity and social opportunity. So within physical opportunity, it's really about your environmental context on farm. So the physical process of being able to go to appointments in terms of other demands. And then the social opportunity is around your social influences and social comparisons. Here's a dairy farmer at the top again. This is actually a scenario whereby he was prompted that he needed to go for an elective angiogram, which some of you may know, and I know we've got a lovely cross-sectoral audience here. So an angiogram is simply a dye test of your heart to understand what the oxygen supply is like to the muscle. And he said, I came back out and I sat in the car and cried physically for 20 minutes. Who is going to milk my cows? I don't know who's going to milk my cows. This was a repetitive theme throughout the interviews. On the right there's a beef farmer, a female beef farmer, who simply, she's not able to access the same benefits or levers that other single mums may be able to. She simply didn't feel she had any support, so therefore she planned her health around the seasons and only was able to go whenever she had backup on the farm. Down at the bottom there, this is a significant quote in the fact that it sums up, exploring exactly what farmers wanted from the consult, meeting that, and perhaps not, and the difference that that can make. So this was a farmer who didn't want any drugs, but yet was given drugs for, an antidepressant for a stress or trauma that he had been through, and it was inappropriate because it really was post-traumatic. He'd witnessed an accident on the farm, and he felt he was giving the clinician trouble. The complexity of his environment, the complexity of his story, the inability to take time off, the inability to go to several sessions of talking therapies, etc., it just didn't fit. And then he suffered the side effects of that medication, and actually it ended up costing his business tens of thousands of pounds. Thankfully, he's able to tell his story now, and he's very passionate about that with other farmers. Now, motivation was by far the largest tranche, and I'm keeping a wee eye on time here. You don't want to be a hypochondriac or crying wolf whenever it's not something that's needed to be treated. So that was very strongly came through with farmers. So in motivation, we're obviously talking about the automatic motivation in terms of rewards, punishment, incentives, and then reflective in terms of our beliefs about our capabilities and roles and identity. Here, I thought this quote was really interesting. The negative media really makes you feel you're not worthy. Why look after yourself? So our self-worth, self-esteem in terms of our occupation are very closely linked, our role in society and how we contribute. And if that's denigrated or if that's felt to be diminished, this actually impacted that dairy farmer's ability to make a responsible decision about a risk factor in terms of cardiometabolic disease. You can't be seen to be sick, very just, straightforward. This arable farmer here, male arable farmer, simply said, no one will do business with you if you're sick, if you're seen to be sick, because are you a reliable credit line? Are you able to take a long-term rental agreement? Is something going to happen whereby the land isn't cared for the way that it should be? And, that is important for sustainability in terms of long-term rental agreements, long-term land management, in terms of all of our environmental and public goods that need to be produced by agriculture. I guess it's sort of, always in the back of your mind, is this a rabbit hole you want to go down? So this particular sheep farmer in the bottom right, he had a friend who had been diagnosed with diabetes, and certainly he said, even if I had every risk factor in the book, I'd still not go because of the disruption that it would cause to my business and what I've seen him go through in terms of the multiple appointments. And we know that eyes, feet, cardiovascular, they're all spread out, and it can impact, it's not, these are working patients, and certainly the system isn't built around working patients. So that's just a summary. And again, this has sort of come up funny on the screen, but a summary of some of the findings, and that's waiting publication. I'll just skip on through and just share with you what we learned. Really, what from this first study, the interdisciplinary lens was really important. So in terms of the farmers, the public health, myself and primary care, and the key kind of outcomes were that co-design was really useful in terms of reaching the people that we wanted to reach. They championed the study, they got it out there, and the results speak for themselves. In terms of moving forward and strengths-based approach, seasonality and the environmental context seem to be key to farmer-centred care. And we've gathered that and took that forward to the next study, which is currently ongoing. And really, this is the question that we want to ask. Can we take the insights from our farmer health behaviours, match those to our rural clinicians' experiences to inform behavioural change interventions to improve the outcomes for farmers at risk of cardiometabolic disease? And at this point, it is still ongoing, but some of the really interesting preliminary findings, I asked clinicians in a strengths-based approach, what gives you pride and self-efficacy whenever you are caring for farmers. So first of all, finding out what motivates them. They mentioned continuity. They talked about home visiting. They talked about generational knowledge of their patients. So who's their mother and father? What's the family history? Have I, what are their children like? That's key to understanding the context around how they manage those risk factors. And these clinicians also in rural areas want to operate to the top of their scope. So they want to be able to manage high risk. And quite a lot of those themes are going against the grain of health policy at the minute in rural areas. Finally, just to give you some other insights around this, strengths and values that rural clinicians see in farmers so far in this study indicate that they do see a high level of community. So if a farmer is connected to their community, that is useful. There's a strong female informant generally behind some of the presentations. They are very capable of self-caring if given the right information and the right follow-up that suits them, and they are highly motivated to expedite recovery. And if we can work with them in terms of that, they find a good response to the management plan. So strategies most successful in managing farmers. This is what we're working on now. We're swapping in and out of these, but just to give you some early insights, clear, brief communication with farmers. Obviously, flexibility and planning with the appointments that they're offered. If they're able to have one in advance, they can plan that into the business. Seasonality, so switching from winter pressures to summer planning. And then meaningful consults front loaded with data. They seem to be responding well to that in practices that have already started those processes. Coding occupation is a very basic one, which we don't do in primary care in general practice, and therefore we can't select out our patients in terms of their occupation, a joiner, an electrician, self-employed, employed. We don't know, and yet they seem to impact our health behaviours quite a lot. So organized clinic equipment. And this on the right is just a depiction from one of the interviews. And you can see this is a river. And this clinician simply said that if we allow our patients to feed in and feed out at appropriate times, there is like a wave, whereby the clinician, there's times in your life where you need the clinician. There's times at times of my life where I can help the clinician in terms of, so that is lovely to see in terms of peer support that we maybe don't take advantage of in our care. So I'm going to take a few minutes just to go through the Northern Ireland Agri-Rural Health Forum. So this is an initiative that some of you on the call are involved with, and these are just some of the pictures from that group. So these are lots of farmers and families from around Northern Ireland. And the problem was that during the pandemic, I received a lot of phone calls from different people saying, we need to do something about farmer health. And we were all going in different directions. And I suddenly kind of realized, actually, if I guide everybody to the same place and then we can help each other out, that would be much more sustainable than us all doing different things for the same outcome. And again, we're really principled on the fact that the wider socioeconomic determinants of health are paramount. We wanted to give farmers equal voice, foster relationships between agriculture and health and everybody that's in between, and then also give the right people equal voice. So whether it be in an organisation, somebody's passionate from the grassroots and can influence, or whether it's the CEO has a really big interest in human health, we don't really mind. It's not hierarchical. It's not about hierarchy at all in this group. It's a forum, and we wanted to avoid wastage in and amongst everybody that was in the group. We were all writing similar papers, and there's no point to that. So building up trust to be able to share that information. Our vision is an agricultural community, agri-rural community that maintains the highest possible level of health and well-being. And our mission is to use practical, innovative and evidence-based solutions to address health inequalities. And really, we're coordinated by Rural Support as our secretariat, which is the farm support charity in Northern Ireland. We bring together key decision makers or key influencers in agriculture, and then we're trying to translate that into incorporating our mental and physical health needs throughout everything that we do, and then hopefully influence strategy and policy as well along the lines. So that's who's in our group. A really enthusiastic bunch. You'll see banks, you'll see charities, you'll see the Northern Health and Social Care Trust, one of our trusts in Northern Ireland, Farm Families Health Checks down at the bottom here, which is a really innovative service co-funded by the Department of Agriculture, Environment, Rural Affairs and the Department of Health. And they go out round marts delivering screening to farmers that otherwise wouldn't attend traditional healthcare settings. And then Young Farmers Clubs of Ulster, Farm Insurance. So yeah, a really big range of people in the Public Health Agency have been really generous in terms of supporting us. A little bit of our timeline, 2021, obviously everybody was on Zoom, and we did that on farm meeting in August, which was fresh air outside whenever we were allowed to meet outside, social distancing. And we've had a really good time since in terms of developing relationships with the Royal College of GPs, launching at Balmoral, doing some One Health things with the vets here. So this was one of our leading vets doing a chat. And then moved on into doing different health topics, so particular health inequalities that evidence tells us impact farmers. And here, just want to make a big mention to the Farm Family Health Checks team. They started doing hot seats of blood pressures, which seemed to go down well, and that has stuck then since 2023. They now do those at different events. And here is our Minister for Health, Minister for Agriculture, along with the British Heart Foundation. Do you know your blood pressure? You'll know your tire pressure, but do you know your blood pressure? That was just one of the resources we developed with them. And moving on down through to innovation then. So Professor Jerry Gormley here with the red lanyard, he's our Professor of Simulation at Queen's, and he came up with the idea, let's take the skin tattoos out to the farmers. We use them with the students to learn about skin lesions. So let's transfer that out to the farmers. And at Balmoral, we use that as a way to invite people to go to screening at the Action Cancer van, who worked with us to develop these resources. And actually on that day, we found more melanomas than Action Cancer ordinarily would in a year. So we wrote up that work, and that went around the world. I think in total, the media generated over £330,000 of equivalent advertising revenue for the charity. So a phenomenal result for them in terms of outreach. We generally meet in non-academic settings. This is my brother's farm, actually, a huge meeting there. We generally have food, and really we don't ever meet in healthcare settings. We don't meet in academic settings. It's always on farm or in one of the partners' meeting rooms. So I'll just skip on through. Any of these resources are available. You can contact me and I can send them to you if you want to print. We can get in touch with the partner that owns them. And this is just our most recent one around respiratory health. Over the past year, we've been focusing on that. Yeah, whole other topic, but all I can say is that this year has been the most successful yet in terms of policy change, getting in touch with the right people around this inequality of occupational lung disease. We've been to London, we've been to Dublin. The dust shakers that were developed with Jerry Gormley, just simply taking the dust out of a tractor cab, putting it in a jar and shaking it. It went viral on social media and really started some conversations going. People are writing articles. Lots of the arable societies have picked this topic up and asked us to come along to talk. So just an example of things flowing and growing legs of their own. The political and commercial determinants of our health are the smoking of our time. I'm sure you guys don't need to be told that. But if we don't work across sectors, if we don't work outside of our silos, we will never be able to address these health inequalities, in my view. And certainly I have an attitude that I'm not ever certain about what we're doing with the forum. We go in the direction that the forum goes, and we cut our cloth to the resources that we have in each year, and that seems to really work because we are not funded. Everybody gives their time of goodwill and resource to what they can, and therefore anything that we do, there's never wastage. We distill it down to the most effective strategy or engagement that we can, and we use our time and money extremely wisely, very much same as what we do on farm. I kind of say, this is St. Patrick's Day yesterday, you've got a Northern Irish speaker, you never plough a field by turning it over in your mind. So my attitude is just keep ploughing on, don't look back. So if anybody would like any more information, you can scan that QR code. It just leads to a little document about some of the detail. The funders that have helped me along the way are along the bottom in terms of the GPART scheme, the General Practice Academic Research Training Scheme, which is funded by R&D and our HSC, and certainly Rural Support and Ulster Farmers Union have been really great along the way as well. So thank you for listening, folks, and I really am interested in what you guys all think. So I'll just stop sharing now.
Thank you, Rebecca. That was very interesting, and I'm sure there will be lots of questions. So I'm going to hand it over to the floor now. Please put your hands up.